Hello, my name is Hugh Panton, and I'm a certified orthotist prosthetist. That is a person that is a healthcare professional that specializes in making prosthetic limbs and orthopedic braces. Today I'm going to share with you what to expect after your amputation surgery. At the VA, you are getting state-of-the-art care by credentialized and accredited facilities. We have a healthcare team that is dedicated to meeting your needs and accomplishing your goals before and after your procedure. Your recovery has many phases, and you can expect to stay in the hospital from several days to weeks based on your health. Your nurse and surgical team will manage any pain that you have while you are in the hospital. You may still experience sensation and/or pain in the missing limb. This is common and should diminish over time. Your physical therapist will help you to learn how to transfer and return to routine activities and teach you appropriate strengthening and stretching exercises. Getting used to a missing limb takes care and patience, so it's important for you to move safely at all times to prevent falls. The nurse and surgical team will take care of your surgical wound while you are recovering in the hospital. After your hospitalization, you will require rehabilitation. This is typically short-term, and you may recover as an outpatient or in a skilled facility. Our team also consists of a social worker that will work with you to discuss your individualized plan and provide you with short-term rehab needs. You will also have continued follow-up with the surgical team and the amputation clinic to determine a plan of care for your new amputation. We have VA community programs which also provide services once you are discharged from the hospital and rehabilitation center. Every person's situation is different. Please do not hesitate to contact your primary care social worker at any time if you have questions. During your recovery, your surgical wound will have sutures or staples. Your surgical team will decide when it is best to remove them. This usually occurs around the 1-month mark. Dressings are typically changed daily while in the hospital. Our hospital staff will provide instructions on how to care for your incision. Be sure to follow instructions and ask questions if something is unclear to ensure that proper wound healing occurs. Immediately report to your care team if any of the following symptoms, as this may be a sign of infection: redness, increased pain, drainage at the incision site, fever, chills, and/or foul odor at the surgical site. After amputation, there will be an increased amount of edema or swelling from surgery. This is normal. Eventually, your limb will heal and the sutures will be removed by the surgical team. This is when volume management takes place. This will most likely be done with a shrinker. A shrinker is a special woven compression garment that is sized to fit your residual limb. Your surgeon will assess your condition and write the order for the shrinker once the limb is healed. The swelling will last weeks and will be reduced with the shrinker. This will help your residual limb reach a stable size and shape. You can expect your residual limb to continue to stabilize for the next 2 to 6 months. Once your residual limb is healed, you will meet with your prosthetist for a prosthetic limb. You will be working closely with this person over many visits over months to years. Each prosthesis is unique to the person wearing it, and your prosthetist is trained to match your needs and goals to the prosthesis that is made for you. The VA also has home evaluations, driving devices, wheelchairs, and scooters. There are things that you can do to help your healing, such as not smoking, managing blood sugar, and practicing good hygiene. By quitting tobacco, you would decrease your risk of heart attack, stroke, and blood clots. If you manage your blood glucose levels, you will improve wound healing. Be sure to wash your hands with soap and water before coming in contact with your wound. Washing your hands after care of your wound will decrease chances of wound infection. Take special precaution with visitors. If they are sick, ask them to reschedule a visit with you. Inform your healthcare team if you have any questions or concerns. Limb loss has a significant impact on your life, which is why we have several resources available to you. We have peer visitors who are fellow veterans that are passionate about peer support and want to make sure no one goes through the limb loss journey alone. We also have a veteran support group that meets monthly to discuss overcoming similar challenges. We offer individual, one-on-one support with behavioral health and mental health professionals. We also have a VA caregiver support program that is available to your family and friends, and a team of VA chaplains available to provide spiritual support. The Amputee Coalition is an educational resource and support system that is available online. There are also community support groups available. Please let a member of your healthcare team know if you're interested in any of these resources. At the VA, our expert healthcare team specializes in caring for our veterans. We are here for you.